Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, so summer has practically come to an end for most of you. Most of you have gone back to school. Most of you are getting ready for the fall. But here's one thing that I want to remind you. You know, you're outside, you're playing with your friends, you're enjoying the outside with your family. You kind of got off your phone and the TV and your computers, and you were interacting more. You know, our mission here at Healthline is to have you engage and have a healthy life. So don't forget all the great things you did in the summer. You can still run, still go to the beach, still get involved with outside, because the most important conversation you're ever going to have is about you and your health. And also, if you go back to school, get some great grades. And if you have a question, ask. A lot of people don't ask questions. So the conversation is all about urology. Joining us from Glendale Adventist Medical Center is Dr. Armen Derboghossians. How are you, Doc?
Very good, sir. How are you?
Good. First time.
Absolutely.
You, me.
Yep.
So what got you involved in the study of urology?
Interest, curiosity, driven primarily by my dad, though. He's a urologist as well. Of course, took a little turn in med school when I decided to just give it a go, and here I am now.
My father was a politician. It's not going to happen. But then again, it's not going to happen at all. But then being an actor, you have to be able to be politically correct with how you say
Absolutely.
your lines. Where did you go to school, Armen?
Started off at UC Irvine.
Okay.
That's my undergrad. Transitioned briefly for a master's program in Chicago, onward east to Boston University for med school, and back to LA for my training, residency.
What's it? You don't work with your father?
I do.
Oh, so you?
Actually, yeah.
What's it like working with your dad in this field?
Unique. It's actually much better than one would think. Kind of hesitant, reluctant, but you know, it's the best of both worlds. I think for him too. If you asked him, I think he would feel the same. You know, gain a little experience and
because he's old school,
veteran touch to him.
Yeah, old school, new school.
Right. And
do you find that you're asking a lot of questions?
Absolutely.
And does your dad ask you questions?
Absolutely.
Oh, I love that.
Yeah, you know, we pick each other's brain, middle of the day. It's actually quite beneficial. He's kind of 1 foot out the door, kind of transitioning towards retirement. I've actually started panicking, thinking, what am I going to do? How's this going to work? Well, that part is fine, but it's just the daily interactions. You know, he helps me a lot of support. You know, I guess you could say he has my back.
I love that.
So yeah, it's a good unity. Office is chaotic, but it's a good chaos. So
I love that you get to spend time in your day with your dad.
Right. Yeah.
Okay, I have a ton of questions for you for the prostate, urological illnesses, and everything we need to know about urology. Okay, call your dad. Pick up the phone, call your dad, send him a text, reach out and make plans to see your parents. It's important. When we come back, everything you will need to know about you and urological illnesses. Don't go away. Welcome back to Healthline. I am Gregory Zarian. So did you call your mom? Did you call your dad? And did you say, I love you? September is Prostate Awareness Month, and we at Adventist Health Glendale want to give you all you need to know about having a healthy prostate, having a healthy life, and having the conversation about what you need to know about healthy prostate health. Joining us from Adventist Health Glendale is Dr. Armen Derboghossians, urologist specialist. Doctor, so, and you said your patients call you son, which I love.
Yeah.
Talk to us about urological illnesses, because when we think of urology, we think about simple things, and most commonly prostate cancer.
Right.
What are some other illnesses we need to be aware of?
So commonly, urology is misconceived to be men's health exclusively, prostate, genitals, erectile dysfunction, that stuff. But let's not forget the genitourinary system, hence urology, spans from the kidneys towards the reproductive organs of both men and females.
Okay.
Exclusively concentrating on the urinary components of female health and all genitourinary components of men's health. The prostate being probably the most famous of these structures that urologists focus on, but illnesses start from kidney stones.
We'll talk about the prostate. in a little while. Let's talk about everything. So kidney stones.
Kidney stones.
How does somebody get kidney stones?
Multifactorial.
Okay.
The two things that are probably the most predisposing factors are hydration or dehydration.
Okay, how much water should someone drink a day?
There's no set amount per se. You know, you see the ads, 8 cups of water.
Yeah, 8 to 10 glasses a day.
But you know, you and a 4'11", 100-pound woman are different.
are.
My recommendation, and from what I was taught by my bosses, my attendings during residency, was your urine should always be a light straw color to clear.
Okay.
That way you know you're adequately hydrated.
Okay.
Certain foods and supplements can alter the color of the
Like
urine.
vitamin B.
Yeah,
Okay.
exactly. So just a general sense of your urine color will be a good marker for hydration.
So I drink between 2 and 3 liters of water a day.
That's great.
All right. So for the average person that doesn't drink as much per se as me, what do you recommend?
You know, there's general stone recommendations.
What
that
is
you
general stone recommendations?
Lemon or
Okay.
citric acid is probably the second biggest factor after hydration and
Okay.
staying hydrated. Low salt,
Okay.
low protein,
Okay.
animal proteins mostly because they're a little more acidic, fish being the most acidic. So if you're going to stay away from certain proteins for the sake of stones, stay away from the fish. Vitamin D, one thing that people tend to do is reduce their calcium when they have stones because they think, oh, I have calcium oxalate stones, which is the most common stone. They start reducing their calcium. Well, your body's going to require the calcium either way, so it's going to pull from the bones. Your body's going to maintain the calcium control tightly.
Okay.
So don't reduce your calcium. In fact, you'll make more stones if you reduce your calcium. So just stuff like that.
And stay hydrated.
Absolutely.
And isn't it true too that coffee and sodas dehydrate you?
They
So with every
can,
cup of coffee,
absolutely.
have a glass of water.
Exactly.
And one thing I do, which makes me feel great, is in my liter of water, I add lemon.
Even better, you're getting the the things I advocate most, lemon and water. You're doing it all at once.
Yeehaw! We're making you proud, Dad. Okay, so this is for men and women.
Absolutely.
Okay, urinary tract infections, your UTIs.
Right.
Is it from dehydration as well?
Dehydration, it's complete different pathophysiology between men and women.
Okay, let's go women.
Women, they have 2 peaks in their life, postmenopausal
Okay.
and during their reproductive years. You know, there's certain techniques you could use. They have a shorter urethra. They have, you know, organisms, vaginal, fecal, anal, rectal organisms that can make their way into the bladder. But I find that UTIs are often overdiagnosed because there's a lot of things that may mimic, even with urine studies and tests, they may mimic a UTI, but women should pee more frequently.
Okay.
They should avoid tight wearing clothes, although it's going to be difficult. You know, everyone's on this cranberry juice kick. They say cranberry juice.
Well, same thing with kidney stones.
Yeah.
Does it work?
I won't advocate for kidney stones.
Okay.
For UTIs, there's absolute benefit shown by drinking cranberry juice reduces a UTI, but everyone waits till they get the UTI, then they start drinking all their cranberry juice. But cranberry juice won't treat an infection, it'll help prevent an infection.
Okay, so you invite people to drink cranberry juice.
As a preventative measure.
Okay, preventative.
Yeah.
And does it go side and side, hand in hand with the lemon as well?
Lemons for stones.
Sands.
Yeah.
Okay.
Yeah, but if you have a UTI, you know, you drink these acidic things like cranberry juice, it might actually aggravate your symptoms because the acidity in an inflamed and, you know, angry bladder, hostile bladder may just make your symptoms worse. So,
What are the symptoms?
frequency, urgency, burning with urination.
Same thing, men and women.
Usually no fevers. You should
Okay.
not have a fever with an uncomplicated bladder infection, but kidney infections tend to have fevers.
And dryness too, like a dry feeling as well?
Absolutely, yeah.
Okay, and
yeah.
this is for men and women.
Men and women, yeah.
Sometimes people get them more often than others. Does it go back to simply just being more hydrated?
Not so much. I mean, there are host mechanisms, host defense systems that, meaning the patient, they're just more prone. They have either comorbid conditions, diabetes, they may have anatomic variations that make them more prone to.
Such as?
For women, it could be the fact that they aren't emptying very well. They may have a bladder that's fallen called a cystocele. They may have some diverticulum, little pockets, kind of like the colon gets, but in bladders. Urine tends to pool, accumulate there. And then stones often harbor bacteria, so stones could actually lead to infections as well.
It's just fascinating that, you know, when we think of urine and a urologist, we think it's a lot more simple than what we're talking about. More with Dr. Derboghossian when we come back. Please don't go away. Welcome back to Healthline. I am Gregory Zarian. So you've noticed Adventist Health Glendale is our new name. Same mission, and speaking of a mission, doctors from Adventist Health Glendale are going to Armenia, as I call it, the motherland, on a medical mission trip to bring you information and to do what they do every day, which is give you information and save lives. So this is to all of you that are going to do something different, and I'm personally proud because my father, Larry Zarian, used to go, and he would come back and talk about how fortunate we are here. The most important conversation you're going to have is about you and your health. So please take something from this program or any other show you watch and pass on the information of health. Joining us from Adventist Health Glendale is Dr. Armen Derboghossian, and we're talking about signs and symptoms of urinary tract infections. Doctor, talk to us about bladder control. Because a lot of, like I joke sometimes with friends and somebody will say, hey, what are you doing? I said, oh, I'm doing Kegels. And they're like, well, that's a girl thing. And I'm like, it's not. It's also for men.
Right.
Share with us first of all, why does somebody lose bladder control?
Multitude of reasons. I don't think there's ever a straight answer for anything urologic. You know, women have two forms of bladder control issues. One being the stress incontinence, that's the leakage with the laugh, cry, sneeze, all that. Kegels work well for that. Alternatively, surgery would be another route. The other type is urge incontinence. It's that's one of the conditions that kind of mimics a UTI without the burning, with the frequency, the urgency, the waking up at night. Sometimes they just can't make it to the bathroom on time, and that tends to be another control issue. Men could have both as well. The stress incontinence with the laughing, coughing, that's typically after some sort of urologic procedure like a prostatectomy for prostate cancer or something like that.
And when we said, just to break it down too, what is the correct way, be it men or women, to do a Kegel? Kegel, however.
The best way, the way I tell my patients is when you're peeing and you imagine someone who opened the door and walked in, you had to stop the flow right away, you do that. So you practice while urinating the first few times, and you realize what muscle you're contracting to stop your flow and start again and stop. After that, I could be doing, I'm in fact doing it right now.
Me too.
Yeah. Well,
okay, so, and you invite men, and well, no, it's funny because more men will be like, well, that's a girl thing. I'm like, it's not.
No. Yeah.
And a family member had bladder cancer, and one of the physical therapy tips was to do Kegels.
Right.
Now, is it Kegels or Kegels? Could be both.
I call it Kegels.
Okay, here's to Kegels, and for you that say Kegels, great. And so you invite people to do it when you're driving, if you're watching TV.
Right.
Can you ever overdo it or no?
Absolutely. That's another thing I tell my patients as well. You know, if you're really trying to avoid surgery to keep that control, you're going to do these Kegels. You should do them for about, anywhere between 3 to 5 minutes, slowly increasing your increments, slowly increasing the duration of the contraction. But if you're going to say, I just want to get my workout in the morning and then be free for the rest of the day, you may tire that muscle actually and cause more leakage. So you got to break it up incrementally throughout the day and progressively get longer and longer contractions. They say it helps about 50%. So, a lot of people just have these vague pelvic pains. They come to me and they say, I feel something here. You do all the diagnostics, nothing's checking out. These pelvic floor muscle exercises seem to do the trick sometimes because it's, just like any other muscle, the pelvic floor spasms, has contractions, and if you could quell those contractions, maybe your pains will go away.
Oh, no, I love that, thank you.
Yeah.
So the next time you're having lunch with your friends or going to the movies, just say, okay, everybody, let's do our Kegels, and 1, 2, 3, go. Count to 5, hold, get to 10, release. Because I think it's fun. I have fun with my friends when we do it. Men in the prostate.
Right.
It's a taboo conversation. A lot of people, and I've talked about this on Healthline, that I'm an advocate. My father had prostate cancer, so I'm an advocate of getting checked once a year, and I do the urine sample, and I also do the prostate exam.
Right.
Prostate exam in men, it's taboo.
Right.
Why is that?
Well, no one likes to have a rectal exam, Oftentimes a family care doctor will do it, then they'll send you over to the urologist. The urologist will do it. Maybe you have a GI doctor or a colorectal guy. They're getting these done on a very frequent basis, so it can't be pleasant for them.
Sure.
Understandably. Prior to the advent of PSA, that's all we really had to rely on to detect prostate cancer. But the problem was, by the time you detect something, the ship has sailed pretty much, and there was a lot more deaths.
There is a lot, because isn't prostate cancer considered kind of, along with colon cancer and anal cancer, like a silent killer?
Pretty much all cancers are considered silent killers in my view. There's 3 cancers that the American Task Force screens for, which is breast, colon, and prostate cancer.
Okay.
Coincidentally, those are the top 3 cancers in America and in the world. So it's fortunate that we have screening tools, and if you catch it early, it's curative. But yeah, prostate cancer is without symptoms.
Okay, so here's the thing. Men just have a shame around getting a rectal exam.
Right.
When you say PSA, please share with us what that is.
PSA is a blood circulating enzyme secreted and made primarily or exclusively by the prostate. It's a very sensitive but not specific marker. So we use it today solely for prostate cancer screening. When it's elevated, it alerts us that something may be going on, but for the urologist, all we care about is let's rule out prostate cancer. So I don't want any patient to get scared that if they see an elevated PSA.
It could be from what you weighed, it could be from...
It could be anything from a recent infection to bladder stones that you don't know about, to a recent instrumentation, to a mild smoldering prostate infection you didn't know about. Anything could cause PSA to go up. Sometimes it comes back down, sometimes it stays elevated, but again, not because of prostate cancer. Unfortunately, as men get older, our prostates are going to grow. The bigger the prostate, the higher the PSA. So people shouldn't be alerted or be too alarmed by an elevated PSA until they've done their due diligence and made sure there was no prostate cancer. But in the event or unfortunate event that prostate cancer is diagnosed, at those stages, you opened up a can of worms to say, but you're going to be cured most likely. So, but before that, it was rectal exams, and if you're getting symptoms from prostate cancer, it's not a good sign.
And when we say PSA, the way that you get a PSA checked is through a urine sample. Don't go away, have a glass of water, add some lemon, have a glass of water, add some cranberry juice, and jump up and down 10 times. Call your parents. More with Dr. Derboghossian when we come back. Welcome back to Healthline. I'm Gregory Zarian. The conversation is about urological illnesses, and before the break, we were talking about how to get your PSA checked to see if you men possibly have prostate cancer. Did you know that all men are at risk for developing prostate cancer? About 1 man in 6 will be diagnosed. About 80% of men who reach age 80 will have prostate cells in their prostate. Joining us from Adventist Health Glendale is Dr. Armen Derboghossian. Doctor, why will 80% of men have prostate cells?
Just the way life is. I think every man who lives to 100 will all have prostate cancer.
Is it just because we get older and our cells are
breaking? Just a hormone-driven.
Okay.
I don't know the exact physiology towards it. Just like breast cancer for women, I think the number there is 1 in 8. Prostate cancer, there's no wonder why there's over 300,000 new cases a year just in America alone. The problem comes where it's a very smoldering, slow-growing disease, and there's a lot of issues with when do we check PSA, when do we stop, more importantly, because at some point, more likely you will end up being diagnosed with prostate cancer if we're doing prostate biopsies, and maybe the patient will never need a treatment, never needed radiation, now has to deal with the undue psychological burden of knowing they have a quote-unquote cancer when they might have lived out the rest of their
Sure.
life not even A, knowing, or B, having any effect on their life because of it. They say something about 25% of prostate cancers are actually clinically significant.
Wow.
But nevertheless, it's a very curable disease, and PSA has allowed us to cure a lot more prostate cancers than before the days of PSA. So it's with so many new cases a year, you could do so many studies, and you wind up with all these conclusions. But honestly, annual PSA and the rectal exam are a good way to start, starting at the age of 50. And you and your doctor could decide when it's time to just stop testing.
And if there's family history?
Absolutely, increased.
So
but first
age 40?
degree family.
So you have, and here's the thing too, is we always talk about this at Healthline, is talk to your family, talk to your parents, talk to your mom and dad, talk to your grandparents to see where there were cancers and family illnesses.
Right.
Signs and symptoms. What do we boys look for?
You shouldn't look for anything. You should
Okay.
wait for the doctor to recommend a prostate biopsy based on a suspicious rectal exam, or a rapidly rising PSA, or an already elevated PSA. But signs and symptoms of advanced prostate cancer
Are?
Bleeding,
Okay.
urinary obstruction, urinary
Rectal bleeding.
no, urinary bleeding.
Okay, urinary bleeding.
Yeah. They could actually have some rectal and stool symptoms. If the
Okay.
prostate cancer is large, they could have difficulties with bowel movements.
Okay.
And then your typical urinary symptoms that we discussed, they could sometimes, the prostate cancer could grow to obstruct the kidneys as they drain down, causing hydronephrosis, causing kidney function to reduce. And in advanced stages, prostate cancer spreads through lymph nodes and bones. So bone pain, bone fractures, stuff like that is a serious sequelae of advanced prostate
Could
cancer.
there be erectile dysfunction problems as well?
Absolutely.
Okay.
Yeah.
So one thing I want to say though, and then if you are experiencing anything that seems remotely close to this, call your doctor.
Right.
Don't you find a lot of people that come in and say, yeah, this has been going on for 2 years?
Right. I think, at least in the demographic I deal with, the populations I deal with, they hear the word cancer, they say, why even diagnose it? Because I'm just going to
Well, it's not
pass.
a death, but it's not a death sentence anymore.
It's not anymore, not at all. It's very curative. You just have to accept the risks and push on with your care. If you care about yourself, it's a curative disease, and no one should fear the doctor or fear the bad news, because it's not as bad as it was before, and it's not as bad as it will be if you postpone and delay it. So.
And here's one thing too, because you and I were talking earlier, don't self-diagnose.
Absolutely.
Call your doctor, because a lot of people spin, like, like as you were saying, okay, I'm dying.
Yeah.
Well, no, you just didn't, this didn't happen.
WebMD's.
WebMD.
Yeah.
It's good, it's good for some information, but have a conversation with your doctor.
Absolutely. I have patients bring me their WebMD findings, and I sit
Which
there
they should.
And it's great that they're doing their education and learning about it, but I have to sit there and also educate them on why this isn't the case, this isn't the case. Kind of reassures them, makes them happy. So, proceed with caution is what I say.
I love that.
Yeah.
Doctor, before we have, this is flown, talk to us about how to have a healthy prostate and how to, in regards to the kidney and the bladder and all that. Share with us prostate health, urological health. What do we need to know?
Prostate health, there's certainly vitamins, minerals, supplements, a healthy diet, low-fat diet, obviously smoking cessation or not smoking at all.
Quit smoking, people. What about alcohol?
Alcohol?
Moderation?
Moderation. Everything in moderation
Okay.
is good. Selenium, zinc, saw palmetto, flaxseed oil, all shown to help. Lycopenes, which is a substance found in tomatoes, right? So things like that. Most importantly, though, like we said, it's a silent killer. Nothing could absolutely prevent prostate cancer, and as we touched on before, most of us will eventually develop it. Now, is it going to be life-altering? No, but follow up with the doctor. Get your PSA checked, get your urine analysis annually, and if you need to be redirected to a urologist, they will make the decision at the time.
How important is exercise in prostate health?
Exercise is important in all domains, regardless of prostate health, yeah.
Doctor, it was an absolute pleasure. Thank you
likewise.
for joining us.
Thank you.
So you heard it from Dr. Armen Derboghossian, also known as Son. Couple things. Don't self-diagnose. Drink water. A lot of the reasons, even if you have a headache, a lot of the times you have a headache, it's not because something's happening, it's just you're dehydrated. If you find the color of your urine different from what you know, call your doctor. Drink water. You know, your doctors and your medical professionals are there to help you. They are there to pass on information so you can lead a happy, healthy life. Thank you for joining us. I love having you here. I love our new look, our name, Adventist Health Glendale. And you can also and always find us on social media at GAMC Healthline, YouTube. Also follow us on Facebook at AH Glendale, Twitter, AH Glendale, and LinkedIn, Adventist Health Glendale. Find us on Facebook and ask us what you want to know. If there's any stories from health and wellness that you want to share with us, or something you learned from us that is a feel-good story, we'd love to hear it. Remember, the most important conversation you were going to have is about you and your health. So make it a healthy one. Call your parents, tell them you love them. I am Gregory Zarian. We will see you next time. Have a great day.